Hi, Brenda with the Hospice Care Plan. Today we're going to talk about the facts about what medications hospice pays for and what medications hospice does not pay for. It is all regulated by Medicare rules as to what happens. And there is a myth that when people come into hospice that they take away all their medications and give them just comfort medications, which is not accurate. The goal always with hospice medications when somebody's on hospice is to provide the medications that offer comfort to the patient. And it is true that some medications are no longer serving the patient and that we do ask that they stop those medications. Some people are very tied to their medications and their supplements and they don't want to, and you are not required to stop anything. Now, if it's a medication that you want to keep taking and it is not covered by hospice, then you may have to pay for that medication. So the fact is that we see that when people at end of life take less medications overall and only take the medications that are serving them, they tend to feel better. And when you feel better, you tend to live longer. Hospices differ on how they do it. They have different formularies. But basically, a hospice is required by Medicare regulations to pay for any medication that is for the patient's comfort and any medication that is related to their hospice diagnosis. For example, let's use cardiac. When somebody is on cardiac medications and they're coming onto hospice with a cardiac diagnosis because their heart isn't working well enough and they're headed towards the end of life, hospice leaves those cardiac medications on because when your heart is functioning better, you tend to feel better. And hospice is required to pay for those medications. They're also required to pay for any comfort medications. Another good example within the cardiac is lots of people take blood thinners when they have cardiac disease for different reasons. And people tend to feel they want to keep taking those. Hospice does encourage at that time to stop taking those blood thinners because they're not serving the long, big picture. And as the body weakens and we get closer to end of life, we get weaker. Falls are not uncommon at this stage, and the risk for bleeds outweighs the risk for what a blood thinner has to offer. So again, you don't have to stop taking it, but your hospice may say that you may be required to pay for that medication. And again, hospices have different formularies, so talk to your hospice team. It's about which ones they cover and which ones they don't. And when they fill out the medication form in the hospice care plan, they can mark which ones the hospice will provide and which ones they won't. And another good cardiac one is people who are taking lipids to decrease their cholesterols. We tend to have them stop those because it's a long-term goal of those medications, and people tend to, again, feel better when they're taking less medications. I hope that's clarified some of the myths and what the actual facts are about hospice covered and non-covered medications. Please ask questions and comments and we'll get right back to you. And just ask your hospice. And again, it's always driven by the hospice medical director is the one who is ultimately responsible for what is covered and what is not covered based on Medicare regulations. So go to our website, thehospicecareplan.com, to get a copy of our booklet and continue to visit us on our social media and YouTube. Thank you.